Welcome everyone to our first panel discussion of Health is Well Tracked. The topic is intensive care. To participate in the conversation, we have with us Mr. Gautam Khanna, Mr. Ranjeet Banerjee, Mr. Khanna Hasija, Ms. Rashie Jain. Brief intro about the speakers. Mr. Gautam Khanna is the CEO of PD Hinduja Hospital and MRC Mumbai, and is also the head of Hinduja College of Nursing. He's also a managing committee member of a degree college in Mumbai. An experienced business leader with a rich experience of more than 31 years of successfully managing diverse business and creating sustainable shareholder value in domestic and internationally challenging environments at Hinduja Hospital and 3M, leading culturally disparate teams across APAC, Latin America, based out of US and in India. Prior to this role, Mr. Khanna was the executive director and country business leader of the 3M healthcare businesses for South Asia region, and worked in 3M for 22 years in India and abroad. He has demonstrated skills, expertise in strategy, board and stakeholder management, business turnaround and scale up, change management, team building, customer engagement, and industry advocacy. Currently, he is the co-chair of FICCI Health Services Committee and president of Association of Hospitals Mumbai and the leader of the Western region for NAT Health India. Mr. Khanna is an alumnus of IIT Kanpur and IIM Calcutta. Welcome, Mr. Gautam. Next, we have Mr. Ranjeet. Ranjeet Banerjee is currently serving as the CEO of Cold Chain Technologies. He also has been the executive vice president and president US and Canada region BD and was an executive committee member board of directors BICOM. Ranjeet Banerjee is an extremely successful and experienced medical technology executive who has spent the last 25 years with Becton Dickinson, a global medical technology company. Most recently, he was a BD corporate executive vice president as well as president of the US and Canada regions with responsibility for $6 billion in revenue. Mr. Ranjeet received his bachelor in technology degree in chemical engineering from IIT Kanpur. Welcome, Ranjeet. Next, we have Khanna Hasija, who is the chief customer officer and co-founder at Innovaccer, a health technology company based in San Francisco. Khanna has been instrumental in building Innovaccer's data activation platform with 4 weeks time to value. He is the recipient of the Honorable Mention of Excellence in Technology from Indian Institute of Technology and Franklin Pierce IP Scholar for academic and research efforts in the field of intellectual property and Graduate Student Award for providing exemplary leadership and a global perspective at Franklin Pierce Center for IP at UNH School of Law. He is also the recipient of the inaugural Samsung Stanford Patent Prize for publishing a paper on patent damages at Samsung Corporation, Stanford Law School. Khanna earned an engineering degree from the Indian Institute of Technology, Kharagpur, and a master's degree in patent law from University of New Hampshire School of Law. Welcome, Mr. Khanna. Rashie is the co-founder and CEO of Onco.com. She's focused at a singular mission, which is to build a patient-centric cancer network by making cure better for every patient and caregiver in the world. Rashie was previously in the ventures investment at Johnson & Johnson. Before this, she was part of business development at Amgen. She received her BTech degree from IIT Kanpur with a major in biological sciences and bioengineering. She's an MBA from University of Pennsylvania, the Wharton School, with a major in healthcare management and entrepreneurial management. Welcome, Rashie. Over to you, Mr. Gautam.
Thank you, Naveen, and welcome. Wonderful panelists we have. You heard the bios, and I'm hoping that in the next half an hour, 40 minutes, we will be able to get whatever wisdoms and pearls of wisdom we can get from them and from their vast experience and knowledge. So before we go over to them, just to set the context, in the last 1 year since the pandemic started, what has been exposed, the world has now seen the inadequacy of the healthcare infrastructure across the world. So it is not whether it is the US or Europe or India, everywhere it was lacking. So somewhere there was a shortage of beds, somewhere there's shortage of oxygen, somewhere shortage of protocols, shortage of people. So it's just the healthcare infrastructure is completely inadequate. And as some say that the healthcare has never modernized. It has a lot of modern equipment, but the mindset and the way healthcare is delivered has been exactly the way it used to be decades ago, maybe centuries ago. So is there a way that technology can help us bridge this gap? So that is one of those questions we are going to see. And the other thing we have to see is this: in last 1 year, what was evident is that the healthcare systems across the world, they faced multiple hardships, but they, because of their resilience, they all came back and started giving better care or care as per different protocols to the patients. And now, with in many countries, the second wave receding and the third wave still not there, healthcare is limping back to normal. And what we were trying for decades to see whether any digital health is possible, any technology upgradation is possible in terms of patient care, suddenly we saw a boom last year. So there is obviously an idea for which the time has come. And one more aspect in healthcare before I hand over and ask questions to the panelists is that, healthcare is a human business. So where the patients are distressed, if relatives are distressed, and the person who delivers the healthcare, of course, needs to have the knowledge and the skills and so on, but also needs to have the compassion, the empathy, and to treat human beings like human beings and not like a patient number, and not like a task to be done. Only then you can deliver good patient care and quality care. And so with technology, will that continue to remain? So that is one of those questions. And the last thought I am going to ask the panelists is that we've all seen that the model where patient would go to a hospital or to go to a clinic to meet a doctor. Now, last year showed us that it's possible for the doctor to reach the patient at home because of video consult, because of teleconsult. The question is whether the hospital can reach. And if the hospital reaches, what is the technology? What happens to the data? How do we take care of the data, and can that provide any insights? So I'm hoping in the next 30 minutes or so, we are going to have good discussion. And with that, I'm going to start with you, Ranjeet, first. So Ranjeet, we heard your wonderful profile that you are now in cold chain technologies, and previously you worked with BD for 25 years. And so you have a lot of experience in medical devices and, of course, in cold chain technologies. And can you give us a perspective on how these can help the patient and the healthcare systems currently? What's your view on that?
Sure. First of all, great being here, and a big shout out to all the IITK folks who are on the call today. So, Gautam, you're right. There is a big transformation happening in healthcare, which is the convergence of digital technologies, data sciences, and analytics with the traditional sciences. And that is creating a tremendous opportunity everywhere. And some of the things that I personally been involved with is using data analytics both for internal efficiencies, like can you innovate faster? Can you innovate through collaborations? Can you mine data to get different and better intelligence? So there's a whole internal innovation and efficiency gain. But more importantly, there's also an external value creation that is happening with the data. So examples of that are using data and digital services. Can you track, for instance, the complete patient information, right? Get a full 365 view of everything that the patient has been exposed to for not just the last 1 week, but for the last maybe 1 year. All the conditions that will be very pertinent to giving the right amount of administration, the doses, the medication to the patient. The medication regimen gets kind of influenced by that. So there's a whole thing around patient data, better connected, integrated patient data. The second is all about visibility of medication. So the medications, if you just think about it, they flow across a pretty complex supply chain, very complex supply chain, right? Often multiple countries, multiple geographies, multiple conditions being monitored. So the ability of using data to give visibility, and more than visibility, give assurance that all across the medication journey, all the way from a manufacturer's plant, like let's say a pharmaceutical plant to a patient, that medication has always stayed in the right condition. It's safe, it's effective, and it's also being given to the right patient at the right time in the right route of administration. So this whole ability to digitally track and make sure that the medication is reaching the patient and being given in a safe manner is something that is completely transforming patient safety and patient satisfaction also.
So, Ranjeet, thank you. I'm going to come back to you, and I'm going to ask you to hold this thought, and maybe I'm going to go to Khanna because you mentioned about data, and Khanna here is our expert on data management and data systems. So, Khanna, now, firstly, I want to know how Innovaccer is transforming the healthcare system. What are your inputs to doing that? And is there a way, linking from Ranjeet's points, is there a way to compare what we call as smart health solutions in US, India, China, anywhere? What are your thoughts on this?
Right. So I think just like any industry, I mean, healthcare is going in that path. It's just that it's 10 years behind. But the good part now is that the data is, at least in some countries, the data is digitally available, be it at the clinical settings or at the financial settings of healthcare. And once you start to combine that data from clinical settings and financial settings, there is still a problem, which is variety problem in data. Data is available in varied forms. It's not common standards, which the industry is reaching towards now, finally, after 10 years. But what we do at Innovaccer is we just combine that data together, both all aspects of that patient, clinical, financial, regulatory, and safety, and then start to activate that data to different stakeholders. You can activate that to a centralized nursing care coordination team to do preventive health. You can activate in front of the clinician while they're seeing the patients to remind them that, sure, this patient might have come to you for a chest pain, but this patient hasn't had their eye exam done because they're diabetic for the last 1 year. Can you check that, right? So, or it can be activated to a pharmacist saying, this patient is on so many different drugs and they have to refill at different times. Can you ease out the refill for that patient? And finally, it can be activated to the patient, wherein the patient can exactly know what's happening with them, what care plans have been prescribed to them by different people, and they can take control of their interventions themselves, right? So I think activating data is the most important piece. After unifying it, that's where the journey is going right now. But also, healthcare is a bit local by the country, and the trends and the movements are determined by the country's dynamics, from dollars to the regulations and the incentives that are there. In US, everyone is trying to reduce cost of care. In India, they're trying to increase access of care, and they're trying to improve the systems of records. In China, they are trying to improve automation because China is one of the very few countries which is getting old before getting rich, and which means you have to use automation in healthcare delivery for that low cost economic model. So each country has their own nuance and how you play with that data, but the common trends is unify that data and activate that data to different stakeholders.
Wonderful. And I really like this comparison of China, India, and US about what their priorities are. And I think that determines the requirement of data. Although what you mentioned about integrating what Ranjeet mentioned about the complete patient information is exactly what you're saying, unifying and activating the patient data to various stakeholders. And I think from the hospital perspective, where I come from, I think it's very, very relevant that each stakeholder needs to know what's going on with the patients, not their own silo. So thank you, Khanna, for sharing that thought. So, Rashie, I'm going to come to you. Now, they talked about data. They talked about system and talking about efficiency. I'm going to ask you to talk about patient, because ultimately patient is the reason why we all exist. So now patient, and I know your company is taking care of onco patients, and I'm aware that onco patients go through physical, emotional, mental, and spiritual trauma. So can you explain to us what has been your experience in this and how technology can help alleviate this for the patients? Rashie, over to you.
Sure. Thanks, Gautam. So at Onco, our vision is to build a patient-centric care management platform. And the reason we are doing that is because we understand, like you said, that cancer is a very complex disease. And patients not only go through physical trauma, but they also go through emotional trauma. And there are many aspects of the patient's care that get compromised in their treatment journey. And I think the underlying reason why that happens is because the way you get healthcare for complex diseases like cancer, it's a very localized way. You basically would go to one hospital, meet a few doctors in that hospital, and then hope for the best. But in a country like India, where there is a massive access and specialists are far and few, access to specialization, specialized advice, ancillary support, all that becomes very, very hard in a localized setting. So I think the vision behind founding Onco was to use technology to create an online ecosystem where you can give access to patients of all the different aspects of their care that they need, right from diagnosis to remission. So if I walk you through a patient journey for a typical cancer patient, Onco comes in and we help patients identify the right experts for their care. We give them personalized treatment guidance through experts who may not be located in their cities, but might be important for them to arrive at the right treatment guidance. We give them price discovery. We help them get started on their treatment journeys. And once patients are confident with their care teams, we support their care outside of the hospital by assigning a care management team to them who can help them navigate through their treatment journey. One thing that I want to allude to, which some of you mentioned, was that we need empathy in the way patients get care. And I think in the traditional setting, that sometimes gets compromised. And the repercussions are actually really, really acute for a disease like cancer. And one thing that we're trying to do through our platform is create a patient-facing arm, a place where you can get 24/7 support, you can get emergency guidance, and you can get access to all the different ancillary services like counselors and nutritionists who can guide you. So I think a lot of these aspects, technology can come in and bridge those gaps in between the supply that's very, very fragmented and localized, and make a coherent sort of a platform that patients can have access to at every stage of the disease. And that's exactly what we're doing.
Thank you. Wonderful, Rashie. Wonderful. Talking about giving access, what you talked about, what Khanna talked about, giving access and location agnostic. So I think you're fixing and you're utilizing technology for that. Wonderful. And of course, your 24/7 guidance. It's like, you are in the digitally connected world. So Ranjeet, I'm going to come back to you. We've heard from Khanna, we've heard from Rashie. So now they talked about, data, they talked about empathy, patient. So now from your view, you've seen across the world, you've had experience and you've seen health systems across the world. One of the issues especially in countries like India, is lack of insurance, or if I should say, lack of adequate insurance. So some people have insurance, but it's so low that you can't get anything reimbursed for that. So lack of adequate insurance. You see, there is, even in the US, there is a problem of insurance. So there it is the other extreme. So the insurance rates are pretty high, or some people don't have insurance. Now, you talked about looking at the patient journey, and you said when you look at how the supply chain flows. I'm going to ask you to stretch a little bit and tell me that if we want to provide universal health coverage to the population of any country, whether it's US, India, China, Argentina, doesn't matter, what, in your view, we can think about utilizing digital or any other aspect? Ranjeet, your thoughts on that?
Sure. I think digital transformation in healthcare is impacting all the three elements of cost, quality, and access, right? So if you look at some of the trends that are happening, one trend I'll talk about is the use of data and analytics and data sciences is allowing medicine and healthcare delivery to become more, instead of reactive, to more predictive and proactive, right? That's a very important trend. I think even Rashie touched upon it. So it's like, one is to manage a patient when he or she comes in with a problem, but second is, can I use data and diagnose a problem and predict that it's going to come up, right? So you need better patient data. So that is one aspect of, can you use, and not just patient data, but also using other technologies. How can you be more preventive, right? Now, prevention is also much more cost effective, hugely much cost effective. Imagine if we could prevent a lot of diabetics from getting very diabetic. It's like, if you can catch it early on, it's much more cost effective. So one whole trend here is that I think we have to really accelerate. It's going well, and we have to continue to accelerate. Is how do we get more predictive, preventive, as well as personalized? And you can do all this through digital technology. You can personalize the care management to the individual. So that's kind of one trend. I think the other trend that is equally important that is happening is, I call it the consumerism of healthcare, right? What I mean by that is, imagine if you walk into a store, you want to buy a car, right? You have a choice, and you want to get a good quality, good value for money, or whatever your requirements are. Now think of that in the context of healthcare, right? At the end of the day, if I'm a patient, I want to make sure that I'm getting high quality care. I'm getting it where I want it. If I can get it at home, I would like to get it at home. If I'm getting it in a hospital, I'm getting it at a high quality care. And patient satisfaction, I'm satisfied with what I'm getting. Now, this is another area where digital is going to be very effective. And I think I really like what Rashie said in terms of how she's taking care of cancer patient. It's a comprehensive 360 approach, from the start to the care of the patient to patient engagement post-discharge. All this is enabled through integrated data. So that's another big transformation that is happening, which is consumerism and the rise of patient satisfaction. The other thing, again, very interesting, is all this can be done at actually a lower cost. The cost of, and you probably know this, Gautam, better than anyone, that if you can deliver high quality care effectively at home, it's much less costly than delivering at a hospital setting, right? So I think these are certain trends that could bend the cost curve, as they say, and actually, the change this mindset of, paying for care to paying for actually value that you get out of care.
Wonderful, Ranjeet. Thank you.
I'm going to add one thing to that on the universal health coverage, right? To the point you mentioned. You asked a good question, which is, when you go to some other country, how do you get care, right? I think that the answer lies in front of us. When we travel, we have our debit cards.
Yes.
Right. We go to an ATM and we expect to get the money out. In a similar way, the answer lies is if you go to a clinical setting or at home setting, there has to be a universal health card, which just works and it's interoperable. The financial system has done it. The healthcare system needs to do it.
So, Khanna, since you mentioned that, I'm going to ask you the follow-up question on that. Is how do you, now based on what we heard and your knowledge, how do you connect the hospitals into this in the system, like a universal health card?
Right.
And what about the data security? Because there's the standards for patient information securities are very, very high. So any views on that?
Right. I think you asked two questions. One is how do you get everyone involved in the data sharing, and the second is security. Healthcare, the global community of healthcare standards 20 years ago were recommending very flexible data standards. So things like CCDA and HL7, I'm going very technical here, but those formats were very, flexible standards. But lately, everyone is going towards the API-based FHIR standards, which are very confirmatory. Just like we can exchange data from different email systems or different calendar systems, it just works. It doesn't fail. Healthcare is approaching that. And I'm so happy about India that the national health stack that's being built is built on the latest FHIR stack, which is a very good confirmatory standard. So as every health system and hospital starts to conform on this FHIR standard, this global exchange, not even a local exchange of healthcare data, can happen. On the security side, I think let's go back to the same example of the financial industry. There are two ways to solve that. One is you regulate every local body who is sharing data and make sure that they are secure. Or the second is you build a more, not global, but a more broader than a local data exchange systems. Just the way you have UPI system for financial transaction in India, and it's secure and everyone's riding on it. You have to have, epicenters of data exchanges in each region, and then you can regulate them very well and make it happen. Security is as, I have friends who are chief data scientists of Barack Obama, and they got the Pentagon hacked in 5 minutes. So security is as good as how less you can control it. If you have a lot of things to control, that doesn't happen. So having epicenters, just like you have UPI for payments, you need to have those epicenters who are doing data exchanges, and it can happen. It has happened before in some other industries.
Thank you, Khanna. I am going to just take a move to Rashie for a minute, and then depending on the time, we'll come back to each of you. So Rashie, you talked about providing care to the patient. So my question to you is that you are based in India, but you have experience and knowledge of the other systems. So is there a difference in the way you are providing patient care in an integrated manner for patients across geographies? And second question related to this is it possible for this model to rapidly scale up across the country? What's your thoughts on that?
Yeah, so Gautam, one big difference between India and other developed countries is that in the latter case, they are more payer-driven markets. A lot of the patient decision-making is mandated by the health plans they have. If I take the example of US, what kind of doctors you can go to, what kind of technology support you have. It's a lot is dependent on the network that you have access to and what's reimbursed by your health plan. India is a very unique market in that context. We have, around 10% private insurance penetration, and even if you add people who are on government health plans, the number is remarkably low. 70% of the country is still paying out of pocket. Now, it poses a challenge and it poses an opportunity. I think on the challenge side, we see that, of course, there's a lot of constraints at the end of the patient in terms of what they can pay for, what services they can choose for. Does everyone want multidisciplinary care? That could be a premium service by a tech provider in that context, right? The opportunity, though, is that you actually have a chance to build a truly patient-centric care management service, because you can focus on what the end user wants. You can curate a list of services that can directly speak to the patient, and hopefully through technology bring about cost efficiencies. So if I think about how we've tried to build Onco in the Indian context, we have adopted a model where we can offer a lot of complementary care to the patients through technology, scale that aspect, learn from the experiences, the data that we're getting from our patients, create some predictive models and see if there's some level of assistance that can be offered in an automated way. And all the different services that patients need are primarily chosen by them. So in a way, it's very democratic. Of course, like I said, the constraint is that you cannot really bring in high-end services to the masses. And if I think about how care management will evolve in different parts of the world, I think it's already evolving, right? Like US, we have quite a lot of significant number of vertical focused care management platforms in the market. I think the key difference is going to be that it's going to be less so-called consumeristic in the rest of the world. It's going to be more payer-driven, but more specialized and differentiated. And in the context of emerging markets, in the context of India, we'll have to optimize within the constraints. But the need remains the same. And I think hopefully with better insurance penetration, we can see many things being made available to the end user.
So Rashie, I'm completely in agreement with you. So I'm going to just react to one or two things which Khanna and Ranjeet earlier said and come back to you. Is, what Ranjeet talked about, the preventive aspect, the predictive and the preventive aspect. Medicine is moving to the person, and he talked about personalized medicine. It is moving to personalized medicine. I mean, people like us in the hospital system, we are looking at how we can do more and more personalized medicine. So that's one. And one of my views is, I think the way till now hospitals have been the center for sick people. We treat sickness. So we are called healthcare, but it's actually not healthcare. It is sick care. So I think the way preventive will come, and with the access to information and technology, we will probably have to become healthcare, where we take off the care of the health of the community. So in that sense, which links the preventive, the patient before they reach the hospital. In the hospital, you provide sick care. You exit the hospital, you provide home care with technology, and then you continue to take care with your preventive, and then your analytics and predictive technology, which we talked about earlier, help us. To give you an example, he talked about diabetes. So we found in one of our analysis that X percent of our diabetes patients don't come back. Okay. Now that's surprising, because diabetes means you have to continue the treatment. So the insight we got from that is that they are anyways always coming for a second opinion. So that means we have a leverage there of second opinion. Second thing we found is people are not coming because they know, but they can't afford the medicines. So then you find another way of delivering the medicine. So that's an example of how we got the insight from that. The other thing which is related to what Khanna said about access, I think in India is about access. So wonderful example of that is in last year when we started video consults. Now we are a Mumbai-based, we have 2 hospitals in Mumbai and 1 in Bangalore. So mostly Mumbai-based. But in COVID, we had patients from 260 cities in the country and a few from outside India taking consultation from our experts, from our specialists. So what that meant is that suddenly somebody who's 800 kilometers away has access to our hospital. Now, may not be for inpatient treatment, may not be for surgical today, but at least he's able to reach the specialist. And tomorrow maybe we'll have some solution on that. And if we can, and the third thing about home care, which you talked about, we developed a system where we were able to provide home care for 14 days to patients who were in isolation for COVID by having video consult, online nutritionist, nurse monitoring vitals every 8 hours, sending them the devices so that they can monitor at home. So technically, what would have happened in a hospital for 14 days, we delivered to them at home in many, many cases. So, that has really worked. The question I have I think we have a few minutes, to you, Khanna. There is a question from somebody. He talks about that many countries have health cards that will have an updated records. Is it possible to bring that type of digital card and in India? This is from Rama Raju. Khanna.
Right. I mean, technology is there. The answer is not technology. The answer is what is the makeup of that country, and what are the incentives there. So, like one example is Taiwan never went into lockdown. I mean, they linked their health cards to their passports, to their social security pretty well, and they knew that the people coming in the country are either high risk or no risk, and if they're high risk, they get quarantined, right? So it's possible. Smaller countries have proven that, or a country which has no democracy has proven that. I was meeting someone from Saudi Arabia, and they have 30% private insurance. So I asked the government folks, do you get the data from the private insurance folks? And they're like, we're not a democracy. We can get whatever data we want to, right? So it's about, is it a democracy or not? How are the incentives aligned? But technology-wise, yes. I mean, just like you have your employee cards and you have your debit cards, you can have your health card. And the technology, the FHIR standards, FHIR, are out there, and every system who's going to hook up to it, it can become very easy to get that done.
Thank you, Khanna. Ranjeet, there is a question I'm going to ask you to do that. How does adopting technology for healthcare will affect the cost of treatment? Is it going to be cheaper? I think you mentioned that, but this is from Vikas Parsa.
Yeah. So my belief is absolutely yes. Technology can reduce the cost of care while actually enhancing quality and access. Now, and there are lots of examples. I'll give a very quick example. I'm here in San Diego. I'm on the board of a company that has just very recently, they have launched a wound care platform where they have got the best wound care docs in the San Diego area using a telehealth platform, helping wound management across different parts of the country, even very remote areas like the tribal areas in the country as well, where access is very difficult. Now, I'll also say this, technology alone will not solve the problem. What needs to happen along with technology is, I think at least two other things have to be factored in. One is this change of mindset, the change of governance of healthcare, the change of reimbursement of healthcare from a fee-for-service model to value-based care. Fee-for-service is every time I go to a doctor, doesn't matter what happens, I pay something. That is wrong. That's ancient. And you said that, Gautam, right at the beginning, healthcare has not, that has to go away. A value-based care is, I pay when my condition improves, right? So that's a big shift. In the US, the Obamacare started taking the country towards value-based care. Not entirely, but it started going towards value-based care. The third element is patient satisfaction. and measuring the patient satisfaction. Again, the consumerism in healthcare. So technology aided by governance that introduces value-based care, monetizes value-based care, and supports it through measurement of patient satisfaction, yes, can absolutely reduce costs and give better quality care and better access.
Thank you, Ranjeet. I am going to take that point and ask Rashie a question on what she mentioned. Rashie, you mentioned about delivering quality care to cancer patients. Also, you mentioned that it's difficult to provide high-end care to the masses. So now, based on what we just heard, do you think there is an opportunity to do that in India, especially for cancer patients? Because cancer is one of the most expensive treatments in the patient's journey, right? So any views on that?
Yeah, so I think there are two things that are very exciting in India that we'll see play out in the next 5 years that should bring high-end care to the masses. I think one is, the changing landscape on the payer side. I think there are more reimbursements made available by the government. There's the Ayushman Bharat scheme. There's more awareness at the level of patients, and patients are opting for insurance when they are young, they're healthy. So when they actually, unfortunately, do have chronic diseases, they have access to good care. So that's one, which I think is very exciting. And we'll see this, the repercussions of this play out in the next 5 years. The other thing that's very exciting about India is the role technology is playing in making healthcare become so mainstream. I saw that, and I'm not just talking about my field. I saw that happen in all the other disease segments when COVID hit. People had access to physicians 24/7. People could get guidance on what kind of tests they need. At very, very discounted prices, they could get those tests done, samples picked up from home. There was just so much, I would say, activation that we saw of healthcare services at the level of the masses when India was actually going through a phase where our healthcare system was in distress. And I think, so like I said, technology can play a big part here. And the beautiful thing about technology is that it's I would say, equalizer. There are so many cost benefits that can be actually transferred to the end user if you are using an approach that's solving for transparency, that's bridging the gap between supply and demand, that's making cost-effective service providers, the discovery of that easy for the end user. And I'm seeing that wave happen in India. So I'm really optimistic that we will see a lot of these cost benefits get transferred to masses and they have access to high-end care in an affordable way.
Thank you, Rashie. I need to react to a little bit on the insurance part. I think in India, firstly, I mentioned earlier, people are not insured. And even if they are insured, they are so inadequately insured that this COVID time, they suddenly found out that they have to pay 70% from their own pocket, despite being insured. So I think in India, there is a problem that everybody needs to get higher level of insurance in value terms and, of course, get insurance. So that's the first part. Second thing is this Ayushman Bharat, which is giving access to 50 crore people. So it's a brilliant thing because it's better than having nothing. But I think still there is a room to change that because you'll find many large hospitals across the urban towns their costs do not match the reimbursement from Ayushman. So there is some work to be done there. But I'm going to leave one thought with all of you, the people who are watching, that when we buy a car, you take insurance before it leaves the showroom. A human being is born, you don't take insurance. So we think a car is more valuable than a human being. So I think our mindset that we need to take insurance for children or from whenever we can start, it should be mandatory. It's a mindset. And all the companies I know, of course, give insurance to their people, but they should also make it mandatory health check once a year. If you don't get health check once a year, you are not going to get, whatever thing you can control. But at least it will ensure there is a habit of looking at their own health records every year for a patient. So, I mean, that, and in the end, I would just like to say we are almost end of time, is that what you guys talked about. I think there is now an ecosystem emerging where there needs to be a collaboration across various stakeholders, whether it is from the supply chain, from the data side, from the care side, whether public sectors, whether government, private sector, insurance. I think we all need to work in a collaborative framework for this ecosystem to evolve so that ultimately we can give excellent patient care and, like you said, value-based care to the patients. So it's been wonderful having all of you. I'm thankful and to the audience, and I look forward to having such great discussions again. Thank you so much.
Thank you.